The topic I would like to say this afternoon is post-virus syndrome after COVID-19 and its TCM treatment. The second peak of COVID-19 pandemic has passed in the UK and or maybe in many European countries. Many patients showed some severe symptoms after COVID-19 was cured. Acute, that means maybe the temperature back to normal, the virus became negative, but the patient still have some symptoms. Ryan Perry and first used the name of the post-virus syndrome, post-COVID-19, in June of last year, after the first peak of the pandemic. Traditional Chinese medicine had showed a good effect in the acute stage of COVID-19 treatment. In the post-virus era, it also can play an important role in the post-virus syndromes of COVID-19. Next are the common symptoms. First is fatigue. More than half of COVID-19 patients have showed in various degree of fatigue. It has called post-virus fatigue syndrome, just like ME, also called chronic fatigue syndrome, CFS and ME. I think many of you have treated a lot of cases of ME before. The reason of ME is not very clear, but doctors believe it is connected to the EB virus infection. So if the EB virus can cause the chronic fatigue syndrome, so COVID-19 virus also can do the same. Actually, in the clinic, many patients after the virus is gone, they feel fatigue. TCM theory believes that the mild cause of the fatigue are due to qi and blood deficiency. Look at here. Qi and blood deficiency is the reason of the fatigue. But what reason causing qi and blood deficiency? I think mainly is three reasons. Number one, high fever, high temperature. COVID-19 patients used have the body temperature is very high, can be over 39 or 39 degrees for maybe for a couple of days, even a week. High fever. In Chinese medicine, we believe high strong fever, pathogenic fever will consume the qi. We call it 壮火时气, consumption the qi. That is one reason. And the other reason is the medicine. What's the medicine? When the patient getting COVID-19, he must take many tablets like paracetamol, maybe steroid tablets, maybe even some antibiotic. All the Western medicine can cause the qi and the blood deficiency, and even some more strong medicine in the hospital if the patient is in the hospital. And also some patients take Chinese medicine, maybe herbal medicine. The prescription contains too many bitter and cold herbs like huangqin, dahuang, shigao, something like that. It's very bitter and cold, so it can cause the stomach damage and making the patient qi and blood deficiency. So that's the reason of the fatigue, that is chronic fatigue syndrome after COVID-19. Second is depression. After a few months of lockdown, almost everyone has a certain degree of the negative psychological impact. More than a few months, nearly a whole year, people have to stay at home or work at home. Many people feel depressed. Chinese medicine theory believes my reason of depression is due to liver qi stagnation. Liver qi stagnation causing the depress. What reason causing the liver qi stagnation? Like what I said, lockdown at home is one reason. No matter the patient has been infected or even no infection, nearly everybody after 1 year lockdown, didn't have a social life and isolated at home, very alone. Some home maybe just one person or two person, that causing fear, depression. And some people have to stay in the hospital if they get infection, if a severe case, get treatment in the hospital getting the isolation treatment. He can see more patients. Some people died in the hospital. This can affect his mood, causing the depression. And also, which one of my colleagues before they mentioned, PTSD, yeah, post-traumatic stress disorder. PTSD, yeah, also during the treatment in ICU, and he sees so many people died, and he get very bad emotional stimulation, so causing that is the reason of depression. Another maybe is because lost the job or reduced the income. Thirdly, is primary fibrosis. According to the report, about 21.5% of SARS patients had showed the image of a primary fibrosis during the recovery period. I can show the original paper that is published by some Chinese research after the SARS at 2003. The proportion of the primary fibrosis in the COVID-19 should be similar with SARS. It has been reported that the average survival time after diagnosis of the primary fibrosis is only 2 to 3 years. And the mortality rate is higher than most of cancer. So primary fibrosis, also called chronic cancer, same like cancer, is very difficult to treat. Number 4 is fibromyalgia. Some patients has experienced the body aching after COVID-19, and the pain is wounding. The position is mildly in the musculoskeletal system of the back and limbs. The pain is usually combined with the fatigue and the depression, like we mentioned before. Fatigue, depression, muscle aching together. The Western medicine diagnoses this muscle pain as fibromyalgia. The reason of this disease is not clear, but it is believed to related to the stress, immune disorder, and EB virus infection, and other factors. The cytokine storm caused by the COVID-19 virus is very likely to be the new cause of fibromyalgia. Number 5 is heart failure. Research showed the COVID-19 firstly involved the human body through the ACE2 receptor located on the cell surface. Many patients developed viral myocarditis and pericarditis after COVID-19, which lead to the heart failure. For some elderly people who have the history of coronary heart disease, after COVID-19, the patient can still be aggravated by the heart failure or arrhythmia. This becomes the main reason of the death of the elderly COVID-19 patient. Look at this picture. The important commonalities between the SARS-CoV-2 and the SARS-CoV was found. SARS-CoV-2 used the SARS-CoV receptor, that is ACE2 receptor, for intracellular. This is the SARS virus. Look at SARS virus. This is COVID-19, also SARS-CoV-2 virus. From the structure, you can see they are very, very similar. They share the same receptor to enter the cell, which is ACE2. So because they are very similar, so the symptoms they cause also very similar. The treatment reaction to the medicine should also be very similar. This picture shows the COVID-19 virus into the share through the ACE2 and causing the cytokine storm, interleukin 2, interleukin 6, interleukin 1 alpha, and interleukin 8, and the B cell, NK cell, T cell, and causing the multiple organ failure, not only heart failure. Heart failure and also primary pneumonia and heart failure, cardiac failure, and also could be kidney failure and brain function damage, multiple organ failure. Number 6 is the lost sensation of smell and taste. COVID-19 patients, many people lost the smell sensation, and in some cases, the patient lost the taste. This condition is very, very common, and it has become one of the characteristics of the symptoms for the diagnosis of COVID-19. At the beginning, last year, and it's not very convenient to do the virus test. Some people just diagnosis just because the patient lost the taste and the smell. We can give the diagnosis. Maybe 80% can be is COVID-19. After the virus, the recovery of the smell and the taste is often extremely slow process, and it is still uncertain whether it can be completely recovered. Some people believe this condition is reversible, but the process, it can be the taste and smell can be come back after a year. But if you get some treatment, maybe it can come back quickly, maybe just 1 or 2 months. Even it is reversible, but if get some treatment, we can make it completely recover and also quickly recover. Number 7 is impaired productive function. Studies have shown the COVID-19 destroyed the lung cell and the ACE2 receptor protective pathway. The expression of ACE2 in the ovary and the testes indicate that this enzyme affects the germ cell and the fertility function. This has been approved by the research report. The COVID-19 may cause in the male or female infertility. Not only men, can be both gender. The impact of the virus on the fertility function will be gradually relieved in the future. Not really immediately, of course, because only 1 year we can't see. But after next few years, maybe we can find more and more people can suffer from the infertility, which may be due to the COVID-19 infection. It is similar like the infertility caused by the viral mumps. Viral mumps can only causing the male infertility, but COVID-19 can be causing the both male and female infertility. The last one is I just added this about an hour ago. It is reactive arthritis, because I read this report. It is published just a few months ago at December last year. This author is from Pakistan. This report, you can read on the internet, the whole paper. And you can see, this is the joint. This is normal. You can here you can find some infection, knee joint. This infection is a kind of a reactive arthritis after COVID-19. Funny enough, I also noticed in my patient, at least 3 of my patients after COVID-19, they have similar joint pain, and one case at her cervical vertebra has developed osteoedema. Osteoedema, also called bone edema or bone marrow edema. Very bad pain on the neck. I think maybe this also is kind of reactive arthritis. So be careful. If some COVID-19 patient come to see you, if they have the arthritis as joint pain, maybe it is related to COVID-19, called reactive arthritis. Next, shall we discuss in some TCM treatment? The TCM treatment, first, post-viral fatigue syndrome. In TCM, we believe this is due to qi and blood deficiency. Of course, the treatment should be tonified qi and nourishing the blood. Which formula is the best of qi tonified? We all know 四君子汤. Which is good, best for nourishing the blood? 四物汤. Yeah. 四物汤, 四君子汤 is good for qi tonified and blood nourishing. We can use them at the same time. And also, Gui Pi Wan or Gui Pi Tang is another good option. So we can use Gui Pi Wan, 沉下六君子汤 plus 四君子 and 半夏陈皮. So 四君子汤 plus 半夏陈皮 because lung is matter and spleen is earth. By tonified earth can benefit the matter. So 沉下六君子 is for this purpose. We can add the 四君子汤 for tonified spleen and benefit the lung. So that is about, look at this is from NHS website under post-virus fatigue of the COVID-19. It's very common. So that's why I put it at the first. The second is the post-virus depression and PTSD. Depression and PTSD, treatment principle is same for remove the qi stagnation, remove the lever qi stagnation, and come in the heart shen, which Dr. Tianjun Wang has mentioned about the depression and mental problem treatment. I would like to select the Xiaoyao San first. Xiaoyao San, if powder, we call Xiaoyao San. If the pills is Xiaoyao Wan. If we use a decoction, that is Xiaoyao Tang. Another is Cai Hu Shu Gan San, similar like Xiaoyao San. Also, Bai Zi Yang Xin Wan. If heart shen disturb, we can use Bai Zi Yang Xin Wan, Tian Wang Bu Xin Dan or Bu Xin Wan. And 甘麦大枣汤. 甘麦大枣汤 is for treating the 脏燥 syndrome, for some hysteria. Yeah, we can use 甘麦大枣汤, and sometimes for sleeping problem. It also works very well. This I usually focus on for depression treatment. I select these 5 formula. Each formula pick some herbs. This picture shows the mechanism of the Xiaoyao San for anti-depression. It was published for a group of my former colleagues in China. It's very good research. It consults Xiaoyao San formula and through the drug target network, and can affect and produce similar function like antidepressant. I don't recommend to take antidepressant because antidepressant has a lot of side effects. It doesn't work. Many people after take antidepressant, they feel more depressed, causing a lot of side effects. In this condition, nature herbs, nature antidepressant should be a clever choice. Thirdly, is post-virus primary fibrosis. Because with primary fibrosis, the patient breathing function will be getting worse and worse. So like the cancer. So it's quite difficult to treat. In the Western medicine, they don't have a good solution for the primary fibrosis. My opinion is we can use 清燥救肺汤. 清燥means clean the dryness. 救肺 mean to save the lung. 清燥救肺汤 and 疏子降气汤 疏子降气汤 is very commonly used for asthma treatment. So it's good for primary fibrosis. 三子养亲汤 also good selection. And modified 玉屏风散 I made a super link. I published a paper just in my blog, just talking about the modified 玉屏风散 to treating the primary fibrosis, and also I made a short video about this. You can see the short video after you click this super link. You'll find my short video. This research has a research used the animal model. They gave the mass to injection the blood machine and to causing the laboratory animal model of the primary fibrosis, and then give the 玉屏风 treatment. And they found 玉屏风散 can significantly reduce the primary fibrosis. It's very interesting research. For some single herbs for primary fibrosis, I recommend these 5. Number 1 is 丹参, and then 黄芪, and then 沙参, and 川芎. This one is 虎杖. First of all, 丹参 is most commonly used for treating the fibrosis, not only pulmonary fibrosis, but also for the liver fibrosis, kidney fibrosis, many fibrosis. 丹参 is a very good selection. But others is good for primary fibrosis treatment. I have read a report. Shandong TCM University, read a PhD student, they published a paper about use the Chinese medicine treating the primary fibrosis. They have developed a patent medicine. That is many years ago after the SARS, and the patent medicine called Fei Wei Kang. Fei Wei Kang is special for treating the primary fibrosis. The minor ingredient similar like this. They use 丹参. Next is the fibromyalgia. Fibromyalgia, I think the pain, muscle aching. Acupuncture is the first, is good selection. Some fibromyalgia combined with the fatigue, with the depression, or maybe no fatigue or only pain, only muscle pain. Acupuncture is the first choice. We have many acupuncture specialists. We all have many experience on pain, treating the pain-related disease. Depend on which area pain. We can use subcutaneous acupuncture. We can use the ordinary acupuncture. Yeah. Just we can use Usher points. Also, we can use the distance points. So I don't take time to discuss it about acupuncture treatment, but fibromyalgia, I strongly recommend try acupuncture. Heart failure, like we mentioned, the heart failure after COVID-19 is quite common. Maybe some patient is heart failure, some is not failure, but heart function reduced, discount. Maybe they just feel short of breath after exercise, and also some people the heart rate keep on fast. Even COVID-19 passed for a long time, but the heart rate always around 90 per minute. Still a little faster than normal. But even do a little exercise, it can go 100. So that is heart function is reduced. Not as bad as the heart failure, but the heart function is reduced. So this condition we can use 血府逐瘀汤、生脉散、四蜜汤 and 苓桂猪肝汤. 水府逐鱼汤 is original from Qing Dynasty. It's from Wang Qingren. I often use this formula for treating coronary heart disease. Many research show it can improve coronary circulation of the heart. It benefits angina. 水府逐鱼汤 is if you search, you can find hundreds of papers published about 水府逐鱼汤. Even it is the ancient traditional formula in the Qing Dynasty, but it has been widely used in the clinic. 生脉散 is only 3 ingredients. 人参麦冬五味子. It's good for treating the. We can put these 3 ingredients inside the 血府逐鱼汤 and to benefit the heart function, improve the heart function to treating and prevent heart failure. 四逆汤 also from 伤寒论, only 3 ingredients. 附子甘草干姜 only 3. So we also can put according to patient symptoms. We can't make sure we must use which formula. According to different patients, maybe they have different clinical manifestation. We select a different formula according to patient symptoms. Maybe 四逆汤, if more yang deficiency, we use 四逆汤. If more yin deficiency, we use 生脉散. If more blood stasis, we use 血府逐鱼汤. And 苓桂猪肝汤 can expel the water retention in the heart and lung. So 苓桂猪肝汤 also from 伤寒论. So in this condition, 苓桂猪肝汤 also is good choice. 茯苓桂枝白术甘草. It seems quite simple and easy, but it works very well on some heart failure patients. Number 6 is the treatment, how to treat the lost smell and taste after COVID-19. This picture shows, you see, the taste buds. There is a nervous connect to the brain, and also the smell, olfactory buds also connect to the brain. So that's why patient can have the sensation of taste and the smell. But after COVID-19, maybe the nervous has been damaged, so the patient lost the taste and all smell. I mostly recommend to use acupuncture. For smell loss, we can puncture some points around the nose, like yin xiang, large intestine 20, and bi tong also called upper yin xiang, just above the yin xiang on the nose, and yin tang between the 2 elbows, and shang xing in here, and bai hui at the top of your head. Also, we can use some scalp acupuncture, the treatment for lost smell, and sometimes we can use the electric acupuncture, add some electric stimulation. After a couple of sessions, the smell can be retained. If good treatment, maybe just 1 or 2 sessions, very quickly recover. And for lost taste, we can put some needles on the stomach meridian. Stomach meridian, the distance point is stomach 36, definitely. But local points can be used stomach 4 and 6. 4 is 地仓, 6 is 下车, just around the mouth. Also, we can use 连泉 at Ren 23, just on the neck, on the middle of the neck. We can use 连泉地仓下车 and also stomach 36, 足三里. These points can help for the taste loss. Number 7 is infertility after COVID-19. Like we mentioned before, the COVID-19, after if take a few more years, maybe we can find more and more men or women suffer from the infertility. If they ask their history, maybe they used to get the COVID infection. ovary function or testic function has been damaged by the virus. We also can have 五子眼中丸 is very famous formula. It can improve the sperm quality and quantity, and to improve the sperm mortality, improve the semen liquefaction time, and increase the reproductive ability. 五子眼中丸，五子 mean 5 seed. Look at 枸杞子、车前子、菟丝子、五味子 and 覆盆子。These 5 seed mean 五子。眼中 mean develop the generation to product the next generation. One mean pills. These pills also many pharmacologic research has been done about this 五子眼中丸。This super link is it can go to my English blog. It's one of my paper talking, just discussing about this. The paper's title is The Magical 5 Kinds of Seed. You can have a look to get some more information about 五子眼中丸. Currently, 五子眼中丸 not only treating male infertility and also suitable to the female infertility. Should be the first choice for the infertility treatment. Last one is reactive arthritis. Reactive arthritis. Chinese medicine basic theories believe it is kidney dominated the bone. So any medicine, any herbs, or acupuncture, if we can tonify the kidney, that will benefit the bone. So the treatment principle should be tonify the kidney and strengthen the bone. I would like to select modified 独活寄生丸. 独活寄生丸, one is tonify the kidney and the liver. The other is expire wind and dampness. For treating the rheumatoid arthritis or osteoarthritis, I often use this to treating arthritis. Rheumatoid arthritis is due to wind, cold, and we call it B syndrome. It is due to the wind, cold, dampness, 3 evils. So 独活寄生丸 has good function. And osteoarthritis mostly is due to the age, because especially the ladies after the menopause, they have osteoporosis. After osteoporosis, they have some joint pain here and there. Mostly is the knee joint pain. That is can be osteoarthritis. But reactive arthritis should be similar treatment with the rheumatoid arthritis and osteoarthritis. We also use the same treatment principle, same formula. Modified 独活寄生丸, how to modify it? I often select my tutor's idea to add some 藤 category herbs, like 宽筋藤, 落石藤, and 鸡血藤, and 清风藤, 海风藤, a lot of. After 2 o'clock, I will deliver a CPD course, LACA CPD course, just talking about the treatment. Today we talking treatment of the metabolic syndrome, and the next week we will talking about how to treat the B syndrome. With the B syndrome, just a joint pain, with my tutor, Professor Deng's clinical experience. So that is another big topic. I think if the joint pain is maybe they don't have the history of joint pain before, just happened after COVID-19, maybe it is due to the reactive arthritis. That is a new report just a few months ago. It published by a doctor in Pakistan. Conclusion. No matter what kind of post-virus syndrome after COVID-19, we all can help. We can help with acupuncture, with herbs. That's all for today. Do we have a question, Tang? I'm happy to answer any question if you have.
Thank you, Dr. Tang.
Yeah.
Thank you for your great presentation.
Thank you, everybody. Thank you for your attention.
Yes, now it's time, it's Q&A time. So if anyone have some question, we have 5-10 minutes for questions. So we can see Jin Lianhua. Oh, you're so lovely smile. And you can see Thomas from Germany, Jin Lianhua from Slovenia, isn't it?
Slovakia.
Slovakia.
A lot of thank you. A lot of thank you.
Oh, thank you. Thank you.
It's very nice. Very nice.
Thank you. Can you see Thomas from Germany? I can see Roland from Netherlands, isn't it?
Okay, good. Goodbye, everybody. Bye-bye.
Goodbye.
Bye.
Goodbye.
Bye.
Bye. Thank you. Bye.
Thank you.
Bye.
Okay, thank you. Bye-bye.